Hello, everybody. This is Dr. Dan Cardolicchio. I want to welcome you to the Destination Health podcast, Finding Function in a Dysfunctional World. I took a little break because I was podcasting like 3 times a week, sometimes 4 times a week. So I'm back at it, and I'm really excited about today's guest, Dr. Isabel Bogdan. Dr. Isabel, how are you today?
I am fabulous, amazing, and fantastic.
I love that. And
Thank you for having me today.
Oh, you're welcome. And Dr. Isabel and I have becoming friends, and I asked her to come on, and we're going to be, discussing a lot of different things about female health today. And as you all know out there, it's becoming more of a wheelhouse in my world. So, Dr. Isabel, Columbia University, little university in New York City, doctorate in nursing practice, specializing in women's health. Dr. Isabel, her mission is to bring transformational approach to where women gain a spiritual connection to maintain naturally young, strong, and beautiful. I love that. She wants to guide individuals from illness to a wellness spectrum. Listen, females are suffering more today than they've ever have. Anxiety, postpartum depression, obesity, heart disease, diabetes, risks of breast cancer, autoimmune conditions, lung cancer, endocrine, inflammation, right up our alley. So, Dr. Isabel,
right.
Dr. Isabel, thank you very much for being on today.
Thank you. I'm sorry the sun is like beating on me, but so Dan, the number one cause of death is cardiac disease. And this is where my passion took place, and I founded Believe.co. Believe.co is my method. It's my program. It's my philosophy of life. And I believe that women in particular, because my focus is women's health. I'm a women's health nurse practitioner. Some people have said, well, that's a little sexist in today's day and age. That's okay.
It's not.
People's ideas are, and their ideology is okay. Like, I'm okay with thinking whatever you want to think, but that's my title, right? That's my title. That's what that's my graduate degree. So I grew up in the Southwest. I'm originally from El Paso, Texas. Got my bachelor's and my master's from University of Texas in El Paso. And the fact that I lived down there, I saw a ton of disease, right? Mm-hmm. This is 1995. This is 2003, 2005. I'm in like my young teens, in my early 20s. I'm taking off in my career, and I'm working as a labor and delivery nurse on the L&D unit. And the focus at that time was diabetes and preeclampsia. Time, let's fast forward time. It's the year 2021. Dan, nothing's changed. Okay.
Right.
We've got all this high tech. We've got a ton of medications and a lot of information and iPhones and iPads, and there's resources everywhere, and women are coming in sicker than ever. So I said, something has to give. Mm-hmm. All right. So I have to do something and not be a bystander. And so I created my 6, 12, and 24-week program. And the idea is to refocus and hit a reset button using the cyclical monthly cycles, either in puberty, in early adulthood, and menopause, perimenopause, and even in postmenopause, okay? Because it takes 3 months to reset the body, as we all know. So the idea is to get somebody started. And you had just mentioned this, that it takes time for somebody to clear their habits and clear their day-to-day. So that's where the 6-week program starts. And that's where that comes in. We start to journal. We start to dismantle what it was and where it was that you lost yourself along the way. We figure out, was it your busy soccer schedule? Was it if you're a young kid, or was it having kids, or was it getting married, or was it that damn divorce? So there's a lot of times in a woman's life as she changes, that she loses track of who she is. Right. And then the loss of the person who you once were, or where you were going, gets put on the sidelines.
Right.
So that's the emphasis of my program. And it works with measurements such as I send over a blood pressure kit, a scale, a bioimpedance scale. I also talk about labs that we can send out. We do the Nutrival tests. And then we we set you up with nutritionists who can actually go over your 24, 72, and even a weekly day-to-day dietary recall. We talk about sleep and circadian rhythms. So there's a lot there. And you decide which one is going to best suit you, right? Which bundle, the 6-12 or the 24-week.
So the one thing that, I mean, there's so many thoughts that come to my mind when you were talking. And the first thing that I thought of is that people may have a comment or two about what you do. But to me, I mean, we're both in the health field, right? We're both doctors. I mean, it's just a specialization, and it's just something that you're interested in. I mean, it's not like any other, it's just like any other specialization, whether you're a cardiologist, you're a functional neurologist, you're an orthopedic surgeon. So for those of us that are listening today, you want to have somebody that specializes, that they can really help you out. And that's a great thing. I don't think that there's anything wrong with that. And you have to study something. In our field, you study something and then you gain the clinical experience and so forth. That's what I teach my students. And, you know, you started off with cardiovascular disease. And let's just go back there for 1 second, because cardiovascular disease traditionally has been a male type of disease, right? When I was 37, I had mine. I had a heart attack. So at what point, what was it that made this now cardiovascular disease number one killer among females? I mean, what made it a female disease besides a male disease in addition to?
So there was a lack of data. Women were not being researched up until 1995. Somebody has decided that, oh, that's right. You know, the NIH was like, we're lacking research on women. Oops. Why? Because more and more women were starting to come into labor and delivery with preeclampsia, status post-stroke, postpartum cardiomyopathies, and we're seeing it in larger mass numbers. So the severity of disease was not being talked about because it wasn't being measured and it wasn't scalable. So now that it's in our face, we have to talk about it. And for me, it's so important to address obesity, because being overweight, 20 pounds over what you should be, your height versus your body surface, is going to bring on more inflammation. So it's not about looking like J-Lo. It's not about, you know, causing you a body complex or being body negative. It's about being realistic and really hitting home with love and using body positivity as a way to say, hey, we need to do this because we need to decrease the inflammation in our body so that we can decrease our risk of preterm labor, preeclampsia, postpartum strokes, and even strokes in the aftermath, because studies say that if you do develop preeclampsia, you will develop inflammatory antibodies that increase your risk of a stroke up until 30 years after you deliver. And that's significant for me because I'm in this field. So I said, hey, Isabel, you got to stop being a bystander and you got to start educating. You got to start speaking loud about this problem.
Right. And it is an important problem. And you and I were talking offline that, you know, I have some colleagues and mentors that are doctors and physicians and nurse practitioners and so forth, that you know, they're very passionate as you are. And if you said to them that it was sexist, oh boy, they would just go off, because it's not. So you have to look at this because, you know, if you have a woman in their 40s and 50s inflamed from eating improperly, from their lifestyle, environmental toxins, whatever that is, can lead to cardiovascular disease, can lead to a metabolic syndrome, lead to a diabetic type of a situation. You're just cutting your life. The quality of your life now becomes poor. And if we are armed with that data, therefore that knowledge, now we can practice and move it forward. That's where you want to lie. That's what we do for a living, right?
Exactly.
And what I found that's interesting in my practice, and why I'm studying hormonal imbalances more, weight loss resistance more in the female population, Dr. Isabel, is because initially I started seeing a lot of men because that's what I was looking for. But at some point in time, the men said something interesting to me. Not only am I overweight, but my spouse is overweight and they can't lose weight. So now I started bringing them in, and now I'm doing the same testing on them. And I'm like, oh, they can't lose weight. There's insulin resistance. There's all of these conditions.
Cortisol elevation, testosterone.
Cortisol, all of that. Insulin's all over the place. So now I'm saying it's the same, different, but the same. The same struggle, the same disease process that needs to be looked at. So now I'm seeing a lot of females that are coming through. And it's very difficult. You get into those 40s and 50s, you know, you've had 3 or 4 kids, right? Postmenopause. Talk about that, because that really plays havoc with the female's body. And that's okay to say that, because we have to look at what you had said before, the word real.
Yeah.
So talk about that. Let's motivate, educate, and inspire at least one female today to get to see one of us, or to see somebody to get back on track.
So what happens in postmenopause is that definitely you have a hormonal imbalance. You can have either estrogen dominance, even though you're not producing as much estrogen, that's going to throw you off, right? Because you're starting to collect more body fat. Your muscle ratio is going down as you age every day.
Right.
Calcium's being depleted, right? Your circadian rhythm is starting to change. Thyroid dysfunction starts to take play because everything starts to slow down. That's just part of the metabolism. So you can either look at this at a cellular level, which you should. You look at the effects of aging on the mitochondria. You can look at, so you can also look at the effects of aging on the telomeres. So you can look at this as like as close and as astute as a cellular structure, and then you can look at how it manifests into the body.
Right.
So then now you have weight gain, right? You have hair loss, you have mineral bone depletion, you have fatigue, you've got depression that sets in, and all of it has to do with how you're revving up your metabolism and how you're helping your body get back into shape. And it's called anti-aging and prevention rejuvenation, right? And so you have to look at what you're eating and what you're consuming, and the times of the day where you would need to like make these changes so that your body can become less sensitive to the effects of aging, right? So you want to wake up in the morning, you want to exercise, you want to use a certain specific type of exercise that's going to help you use naturally the insulin that's already there. So you start looking at fastings in the morning. If your fasting is high, then that's above 95, you're already looking at a risk of insulin resistance and diabetes, right? And so you're going to already feel a little groggy. It's not going to help you to eat that egg sandwich. It's not going to help you to have oatmeal with an extra, tablespoon of brown sugar, even though that seems healthy. Or you know what? I just posted on bananas. Bananas are not unhealthy, but they might not be the ideal fruit for you. Right? So we have to look at the entire day, on a day-to-day, on a moment-to-moment basis, because you can have the woman come in and say, hey, guess what? I have oatmeal with bananas, but yet the bowl is like this big, right? And like the entire banana, and then there's sugar on top of that, and it's not the correct kind of oatmeal. Not only that, but you could have even a woman who says to you, I'm using this kind of protein as a protein enhancer to increase my muscle mass, but it could be the wrong kind of protein, right? So it's all about looking at things now at a micro level and really looking at the day-to-day, the hour-to-hour, to make these necessary changes, because as we age, our body becomes more sensitive. So we have to rev it up.
Yes, and it's interesting that you're saying all of this, because I just did consultation with a patient in their 50s, and after we got done with the consultation, even before the exam, she was already crying, because there was hope at the end of the tunnel, and it's interesting that I talk to those that deal with females and males in their 40s and 50s, even the males, they come in and, like you said, their metabolism is shot for whatever reason, alcohol, eating poorly. And then when you give them that little bit of hope, you got to have those tissues on your table, because if you don't have those tissues on your table, they're just all over the place. So exactly
Yes.
what you just indicated is what I went through. You mentioned estrogen dominance. What is it, and how do you get estrogen dominance? It's a big word today. We're looking at this from a bio individuality, and everybody's different because that banana could be good, could be bad. We don't know. We got to find out. That's what we're doing on that molecular level. What's estrogen dominance?
It's just the body's producing too much estrogen, right? And you can have it coming off from the excess body fat, and you can have it from coming in from your ovaries. So even women in their 50s that are perimenopausal can have polycystic ovary syndrome, and they don't even show it. They don't even know about it, right? So it's so important to send out these blood panels and look at your FSH, your follicular stimulating hormone, your LH, luteinizing hormone, and you look at the prolactin levels, the estradiols, and you look at where it is that this woman is actually at, right? So like I said, it's so important to look at 50 because we assume that once you hit 50, your estrogen starts to decline, and that might not be the case. Right. And it's so important to have a very important cycle. You have to cycle. And so when you have estrogen dominance, you're not allowing your body to bring down that estrogen when it needs to cycle down, so that your body can enter into its own normal fluctuation without or with less estrogen. And you need to have less estrogen at a certain time, because if you're just hanging out with too much estrogen, it's also going to increase your risk of cancers.
You read my mind. That was my next question, Dr. Isabel. You just read it. What is its relation to something like breast cancer, maybe lung cancer, maybe
uterine
ovarian,
cancer.
Uterine cancer, because those are cancers that do affect females. Not that they don't affect males, but we're talking about females. We're looking at females right now, everybody. What does that mean? And why is that important for a risk of some type of cancer?
So not so much what you have to understand what it means individually when you look at family history of cancers. And this is where genetic testing is so important, because once you start looking at these risk factors, and you can actually get, and I like genetic counselors for that reason, right? Because I'm not a genetic counselor, and everybody has their specialty. And so whenever I send my patients out to have genetic testing, I recommend that they do have these deep conversations with genetic counselors, because it's going to help to articulate the risk. And so HERS2, BRCA positive patients are at an extreme risk of breast cancer, right? And you want to understand where they are with this estrogen dominance. And obviously they should not have estrogen dominance, because it's, like I said, it's going to throw their risk of breast cancer up sky high. And you wouldn't be surprised if they, develop an early stage of breast cancer.
And it's important to make sure that we work with that anti-aging prevention mode. There's genetics that come into play. There's no doubt, but we want to set it up where you're optimally working, your biochemistry, your physiology is optimally working, and that you can make it where you want to prevent that, because again, you want to go into your 60s and 70s like I am, and you want to be healthy. I have a 13-year-old, Dr. Isabel. We were running on the beach the other day. He creams me, but you know what? I run a little bit faster when I'm running with him, just to keep up, just a little bit.
Who's this? Your son?
My son. He's 13 years old. So you have to do this because it's extremely important. Without it, your body starts breaking down. Now, I have a question for you. Did you have anything in your personal life? Any health issues, parents that brought you to this also?
So my mother had a terrible menopause, right? She didn't know what the hell was going on with her. My mom was not very high tech when it came to medicine, right? She's very holistic. She's very natural. She believes in teas and herbal therapies. And when I saw what she was going through when I was 10 years old, and she was going through all kinds of crazy messes, like she was having depression and mood swings, also can be symptoms of estrogen dominance, but not in her case. In her case, it was a thyroid dysfunction. And at the age of 10, I was like, what's going on with my mom? It's clearly not normal. I encouraged her to go get a blood test. I was already doing my research then.
I was going to say, this is where you started your career, right?
Yeah. And so it was easy, right? So she didn't speak English. So we went to the doctor's office, and I'm translating what her symptoms are.
Right.
And the doctor starts counseling me instead of her, because it's not easy, right? The conversation. So I'm 10 years old, and I'm handling the consult for my mother. Mm-hmm. And we did everything. We did at that time, this was 1990. Okay. Right. And he did everything. When I saw her labs come back, when I went with her to the endocrinologist, because I told her, Mom, this is clearly something going on with your hormones. We found out that she was severely hypothyroid. Mm-hmm. And she went on Synthroid, and that was it. Oh my gosh, the crying spells ended, the bloating and the water retention and her hair falling out. She didn't have eyebrows. The eyebrows grew back in, and it was like a new woman.
Right. There's so many things that we can do from a functional medicine standpoint when it comes to a hypothyroid, even hyperthyroid, and a lot of different conditions that can help out, that may be able to mitigate some of the medication. Of course, because listen, my cholesterol was 800. My triglycerides were 1,227. You bet your life I'm taking Lipitor and Tricor at that point. But I still had to make a lot of lifestyle changes.
Yes.
I still had to make it. Now, I'm not taking those medications right now because I've made those lifestyle changes, Dr. Isabel.
Yes.
So that's important to note too, because you got to make those positive lifestyle changes. And this leads me into your 6, 12, and 24-week program. What does the 6-week program look like? Give us some specifics. What is it that you do in the 6 weeks? Does the 6-week lead to the 12 weeks, lead to the 24, or their own individual one?
So the 6 weeks keeps you real. We talked about this before the podcast. Are you coachable? Right? And some people come in and say, oh yes, I want to do this. I want to change. I want to keep it real. I want to do everything that you tell me you have to do. Because it's not me. I don't want to tell you what to do. I want to gently lead you in that direction. Right. Sure. And once we got you rolling, once I feel that you want more, and once you tell me that you want more, then we lead into the 12 weeks. But the 6th week is going to tell us, I'm not going to waste my time. I'm not going to waste your time. I don't feel this is something that I can maintain. I don't have the ability to make the changes or make the habits, right? Because it all starts with the day-to-day.
Sure.
So maybe you go through a life transition where you felt this was something that was going to work out. So it's non-committal, but you discover so much more about yourself. And then we did do the initial lab tests if you opt for that. So you learned about yourself. You learned that there's a journey that you can take. You learned about how to get the journey started. We started journaling by that time. Mm-hmm. We did a deep dive. So I meet with you for 45 minutes on a one-to-one basis. I love the courses and I love coursework and I love the online courses that you can buy, but I get more out of meeting with somebody and understanding what I could have done better, AKA not drink as much, right? Drinking is a huge problem. Alcohol is a big, big problem. And if you drink a little bit too late.
Especially during the pandemic, because I don't know, I'm not gonna go there, but the alcohol stores are open. You can go to the liquor stores, and I was like, huh? Other facilities should be open in addition to, You want
to talk about estrogen dominance? How about that?
Especially when it comes to alcohol, because that just throws off your biochemistry
with
all
men,
over the place, right?
Absolutely.
That's something that you just don't want to be involved in. So, it was interesting on how the liquor stores, remained open during this time, because I think the CDC indicated 29.6 pounds was the average. And I always say those numbers are always conservative in terms of weight gain during the pandemic. My own practice, I saw 50 pounds. I don't know if you had that same experience.
Yes.
It was like 50 pounds.
Not personally, but yes.
Right.
I went on a cleaner diet.
Well, we'll get into that in a second, because let me ask you a question. How do you apply all of this to your life? What do you do? Dr. Isabel, take us through a day where you're going, you get up in the morning. What do you do? What does that look like for you in applying your principles to your life?
I don't dare see a client. I don't dare talk about what I talk about if I'm not practicing it myself.
That's right. That's one of the tips for success in any business. You have to live it, because if you're not living it,
Oh yeah. And that's it, right? So I breathe it, I believe it. I wake up at 5:30 in the morning, not every day. There's times where I struggle, and I'll take a little bit longer, but I'll put myself through a mental meditation, a 7-minute meditation to get me out of bed, because it's not that easy to just get up and put your gym clothes on and go work out. Like we're not robots like that.
Right.
So this is where you have to start, quelling that discomfort and just get up and getting it done, right? Even if it's for 35 minutes.
Sure.
What's your motivator? And so that's what's going to get you up, even in the cold, to go work out, get that treadmill on an incline and start revving up your metabolism, right? Because that's how it starts.
Right.
Or you can do it at the side of your bed. So some of my clients are like, oh, I don't want to go to the gym, but you don't have to go to the gym. You can literally lay there in your bed, or just get down to the carpet and start just move your body, right? So it starts with core, it starts with breathing. It starts with the, opening of the chest, connecting with your diaphragm. So I also recommend breath work as a modality.
Talk about breath work, extremely important.
Well, we're not connected, Dan. Right. We believe that breathing is just enough. And breathing is very dynamic, right? So we have, it can get really deep. We have the sympathetic and the parasympathetic systems, right? And so there's one of the other that you can and cannot control. But one thing that you can control is your breath. And when you can control your breath, you can start to control the nervous system a little bit better, right? So it starts with the inhale and the exhale. And when you have control of that muscular motion in your body, and as you exhale your lungs, as your lungs bring in the air, and it seems so abstract for a lot of people, but I would say for the majority of the population, but we're not taught how to breathe.
Right.
And this should be an educational session that takes place in the 3rd grade. Children should learn how to breathe. Wim Hof.
Yep.
Right. So Wim Hof is very big on breathing, and it's how you move your diaphragm, and it's how you get rid of that excess toxin through the exhale. But it's also moving your chest muscles and your diaphragm, right? So it's amazing. And there's different kinds of breath work that you can do to either help rev up your nervous system, right? Or you can calm it down. You can soothe your nervous system. So for example, when you're running, if you're running and you're running at 7 miles per hour and you're in a marathon pace and you're going really fast, when you stop, you're going to feel a lot more excited. You're going to be like, you're going to get ready. You're going to be in that flight, fight response. Right. You're going to punch somebody in the face if they come at you. You're going to be like, wow, I'm going to get you. But now, if you're yoga mode and you're breathing in and out, you're in Zen mode, right? That reptilian brain is going to be like, I am so chill. This Tyrannosaurus Rex is not going to get me.
Right.
Sit down, right? You're going to be at a whole different Zen place.
Listen, you and I are on the same page 100%. We're talking the same language when it comes to, our approach to our patients. Now, we're almost done here, and it goes quick, right, Dr. Isabel? Yeah. It goes really quick. We're going to have you back on, like I said, because there's so much to talk about. Talk about sleep a little bit with estrogen dominance and helping out females.
Well, so that's one of the main symptoms is poor sleep.
Poor sleep,
right?
Correct.
Yeah. So estrogen dominance is more of a symptom. It's more symptomatology. And then once we run the tests, we can see that that's where we're heading to. And estrogen dominance can also be something of diet, obesity, right? So I hate the word obesity, but it has to do with our environmental factors, what you're eating, how you're consuming your foods. what you're actually eating, and then your stress, right? Because if you're a stressful person and you're just producing cortisol and you're highly anxious and you're just that type of person that's always at that marathon rate, that breath work is really going to help control the estrogen dominance, right? With relaxation, and it's going to help to quell all of those external hormones that are out of play because you're always like on.
Right. Sure.
So
absolutely,
it might take the 24-week session to get you in this
habitual,
to get you into the real rhythm of how do I control my feelings?
Right.
How do I eat differently so that I don't have to have so much estrogen in my body? So then we have to start taking out the things that you like, the extra tofu or the soy or that extra wine that you're having, right? And we want to pump up the protein. And so we want to do different kinds of exercising, kettlebell workouts.
Yes.
So that we can modify what your body's doing. So
Thursdays at 1:30, get your kettlebell, because I have a friend of mine, 5-time world champ, Lauren Kleidman. We do most Thursdays. So if you got your kettlebell, we're not going to do this Thursday. I'm going to Boston with my son for a hockey tournament. But next Thursday, get your kettlebell, join us. We'll bring you on and we'll have a good time doing some kettlebells. So anyway.
That's right. 4 muscle groups. That's what I believe in. So next time we'll talk about the 4 muscle groups that we have to work on.
I love that. And we'll have to discuss that. I like that a lot. So we're almost done here. How can people contact you and how can people get into your practice? Where do they go?
All right. So now I'm at the Center for Functional Medicine in Stamford. Mm-hmm. You can go online. You can go to the Center for Functional Medicine. I'm there with an amazing physician by the name of Joel Evans. He's like the father of functional medicine. I wouldn't say the father because Mark Hyman is the father, and there's a lot of other fathers, but
there's a lot of other fathers.
He's amazing. All right.
Yeah.
And I had been like counting him down to let me like just collaborate with him and let me work out of his office so that I can continue to learn from him and be mentored by him, because there's still a lot of things I don't know. Right. So there's like, I don't know. I'm not a specialist in autoimmune disease and hormonal imbalance, right? So you can fix one thing and then something else will give. So
it's something else always pops up depending upon what's going on.
Yeah, it's tweaking and it's learning how to back off and start something different and having that person lead you down the right path. So that's where you can find me, the Center for Functional Medicine. I'm hosting telehealth consults as well, believe.co.
Awesome.
So you can connect with me through my website or just contact the front desk at the Center for Functional Medicine. And there's a number there on my posts on my Instagram at Dr. Isabel Bogdan.
I will make sure all of this is in the show notes so that individuals can contact you. And we recommend that you contact Dr. Isabel. You can see she has a passion for this. She's very knowledgeable and she has the clinical experience, which I say is the dirty 3-0, because that's what I have in order to help patients out. So it's all good. Dr. Isabel, thank you very much.
Thanks so much for the shout outs, Dan.
You're welcome. Thank you very much for being on. I want to thank everybody for listening. You can find me on social media. You know where to go and you can see where I am. Thank you very much, Dr. Isabel. This has been a pleasurable.
Dan. Thank you.
Pleasurable. And we're just scratching the surface because we're going to have her back on in about 6 weeks. And we'll continue on and we'll talk about the 4 muscle groups that you should be working out. So
4 muscle groups. Oh, we didn't talk about the 4 pillars. We didn't talk about 4 pillars.
Oh, wait, hold on. Let me write this down. 4 muscle groups and 4 pillars. That's our next conversation in about 4 to 6
Which
weeks.
is health, beauty, longevity, and prevention.
Oh, we can get into that. We could do a whole podcast just on that one right there.
Just 4 pillars.
We're going to talk about
That's what I base my philosophy on.
I love it. I want to thank everybody for being here today. Thank you, Dr. Isabel. Until next time, live your best self, and we'll talk soon. Take care.
All right. Bye.